Hello, Dr. Becky with Minot Chiropractic here. Nausea, back pain, pelvic pain, round ligament pain, swelling in our feet and ankles, leg cramps, sciatica, headaches, constipation. What else am I missing? All the joys of pregnancy, totally normal. Something you'd better get used to for the next 38 to 42 weeks of your wonderful pregnancy journey. Yes, these symptoms are common among pregnant women. However, these are typically secondary conditions that are happening because of your ever-changing body. Hormone levels are changing, structure is changing, and therefore all these things tend to come on at different levels throughout your pregnancy. They can also be properly managed and decreased while under chiropractic care. So how can that be? During pregnancies, our body undergoes significant changes. Our pelvis opens up. It becomes a little more unstable with the hormones, more pressure is being put on our ligaments with that baby as it gains weight. And now we start to arch our low back because we have this belly coming out, so we're putting pressure in our mid-back, not to mention our chest that's growing and all the aches and pains that go with that now our mid-back has to support where it maybe didn't have to support as much before. And then you have nighttime, it comes about 9 p.m. and you're thinking, I don't even want to go to bed. The pain is so bad during the night. You're tossing and turning, you can't get comfortable because our hips are aching, they're usually out of alignment, and they just hurt, and it's hard to get to sleep. So how does chiropractic help? What happens right when we get pregnant and throughout our pregnancy is the hormone relaxin increases in our body. This is done to help all the ligaments here that are having to grow our belly. If we didn't have this relaxin, our belly couldn't grow out as far as it needs to. But it doesn't just target those specific ligaments in the belly. It goes to all the ligaments around the pelvis, the ligaments that support your spine. So there tends to be a little bit more instability. That's why when you're going to bed at night and you wake up and everything hurts, things are being thrown out of place even while you're sleeping, when you're sitting, when you're walking, things like that. So proper hip alignment is essential to making sure that we take care of these secondary symptoms. So let's say your pelvis is out of alignment or you're sleeping funny and it went out. So now we're tilted this way. I'm not going to walk around like this all day because that would be a little weird. So I'm coming over here. Now I got some instability in my back, and it kind of just creeps along all the way up during pregnancy. So that can happen when you're walking, when you're sitting, things like that. At Minot Chiropractic, I go over your entire health history, any previous pregnancies that you might have had, your current pregnancy, and we check the structure of everything that you have going on. We do proper movements, and then of course exercises. As you go along throughout your pregnancy, I'm going to give you different exercises to be doing to hold that adjustment a little better, also to help you out during labor to kind of build the muscles around the pelvis. That's just a couple things we do. I have also personally used many resources that we have in town here, such as Serene Circle, that helps support a wonderful pregnancy experience. Pregnancy does not have to be all about aches and pains and not sleeping at night. We only get to experience this journey a limited number of times in our lifetime. So enjoy your journey. Reach out to some of these places and make sure that you are having the best pregnancy experience that you can.